Good evening, everyone. I am Sahana, Registrar of Lakulish Yoga University, and I will be the moderator for today's webinar. On the occasion of 8th International Yoga Day and to celebrate Azadi Ka Amrit Mahotsav, Lakulish Yoga University welcomes you all to a one-day national webinar on yoga for elders' health and well-being in post-pandemic world, sponsored by Inter-University Center for Yogic Sciences, Bengaluru. I request the participants to keep their microphones on mute, and in case anyone has a question, they can type it in the chat box, which will be answered by our speakers. Admissions are open in Lakulish Yoga University for YTTC, BSc, MSc, MA, PGDYT, Diploma, and PhD courses. We have another national webinar tomorrow from 11 a.m. onwards on yoga for women's health in post-pandemic world. Link for the registration will be shared in the chat box. Please do register. COVID-19 pandemic has hit us hard by disrupting health, economy, lifestyle, and most of all, peace of mind. It has pushed us to live in a constant fear of risk of infection and death. The condition right now demands recovery from physical and psychological trauma. Human beings are innately social in nature. We thrive on surviving and prospering as a society. The pandemic times have been the most difficult of times faced by the human era. The constant fear, isolation, drop in economy has led to a great negative impact on psychological health. People above the age of 55 have always been the most ignored part of the society. We feel that after retirement, they will be relaxed, but little do we know that they require the maximum amount of attention. During the COVID period, the elderly not only see deaths of their own age, but also saw a lot of young people compared to them dying right in front of their eyes, and they were totally helpless. This is the most scariest part for anyone, living in a constant fear, losing spouse to COVID, to losing children or younger family members to emotional trauma in the elderly, especially in a country like ours. Emotions are not expressed by our elders. Indicators of issues in mental health amongst elderly are often not very obvious, but if ignored, it can and will cause long-term complications in them. Hence, the dire need to understand the challenges faced by elderly in the post-pandemic era and the solutions or approaches to help them face these challenges. Let's move ahead to the first session of the day. Today we have with us our own Dr. Vijay Kumar PS. He will help us understand elders' health in post-pandemic world, challenges and the approaches. Dr. Vijay Kumar, Associate Professor at Lakulish Yoga University, Ayurveda and Yoga Therapy Consultant. He has completed BAMS, MD Yoga and Rehabilitation, MSc in Clinical Psychology and PhD in Yoga. He has more than 45 scientific papers in the field of yoga, psychology, and medicine to his credit. He's also the author of Handbook of Anatomy and Physiology for Yoga Therapists. He's a well-renowned clinician in the field of Ayurveda and yoga. Over to you, Dr. Vijay Kumar.
Namaste everyone, very good evening. Jai Bhagwan. Just a moment, let me share the slide. Yeah, so a very good evening everyone. Today the topic in front of us is elderly health and the challenges and approach, especially in this post-pandemic era. When we try to understand elderly, first thing we need to understand here is aging, because aging is an inevitable process. As we all know that aging is something which is a gradual accumulation of wide variety of molecular or even the cellular damage that is a very gradual process that occurs over a period of time, and that leads to a gradual decrease in the physical, psychological, and even emotional resilience of an individual. And that in turn leads into morbidity, that is risk of disease, and even untimely death or early death. So aging is an inevitable process, but the problem here is right now, the current scenario is very scary because we all are aging very rapidly. That rapid aging of our population is something which is worrisome at this moment. If we try to understand the global scenario, the population is aging so quickly and rapidly. If you see the statistics between 2015 to 2050 projection, the entire proportion of population will be almost double for the age of 60 and above. That is approximation is 1.2.1 billion the global population of elderly. So that is something which is very scary because this rapid aging is not the normal scenario. In normal scenario, we get to see a gradual, what we call it as graceful aging. Aging should not be rapid. Aging should be graceful. And if we see the consequences of aging, because we know that we have accepted aging is an inevitable consequence. But if we see what are the psychophysiological consequences of aging, even if we try to understand at the very basic biomolecular level, the alteration in cellular communication and even the low-grade chronic inflammation, telomerase attrition, which holds the DNA in our nucleus, and the disturbance in the the entire genome that is attached to epigenetic alteration and lot of proteostasis, which is the better regulation of protein metabolism within the cell and within the environment, and even stem cell exhaustion, cellular senescence, which is again related to even immune senescence, mitochondrial dysfunction, and even dysregulated nutritional sensing. All these things are, though they are normal consequences of aging, but if these consequences becomes too aggressive, too early, then this is something which is worrisome. If we try to understand the very basic, COVID-19, SARS-CoV-2, and how it has influenced the very geriatric population, the elderly population, it has created a very huge global problem when it comes to geriatric population. Why? Because if we see statistically the amount of infection and the level of the detrimental effects of SARS-CoV-2 among the population compared to younger generation, the elderly population has suffered a lot during this pandemic episode because elderly population they tend to have the consequences of aging. For example, inflammatory aging process or immune senescence or even reduced microbiota diversity, which is in turn there is a decline. The variety of their normal psychophysiological presentation becomes a very prone factor for developing SARS-CoV complications and even the mortality per se. So especially when we talk about the complications and the amount of pain and suffering our elders have gone through during this pandemic is it's beyond our imagination. But if we try to understand their the process, the very process because of which they had gone through with this much of suffering is again the consequence of early age. And even if we try to understand the very differentiation, elders routines before COVID and after COVID, it is very clear that you can see that, right? Their functional capacities are good, even though we have very limited, infrastructure for the better support of elderly population. But still, whatever with the existing infrastructure we had before COVID, our elders were able to manage even, with when it comes to their health, recreation, and even their social engagement all those things were more or less going optimally well. But after COVID, if you see the physical conditioning, social distancing, the fear of coronaphobia, and even their basic physical activity routine everything has become very disrupted. And even till date, we are not very clear with how this very COVID pandemic has influenced their physical and mental health. Because the multifactorial implications of COVID pandemic, if we try to understand based on the economic well-being per se, the mental health complications, the responders, the caregivers, abuse and neglect, what our elders have gone through and still going through because of this pandemic, and the vulnerability because of their pre-existing medical conditions with their aging process, and the loss of loved one, even fear of death, so much to take even within a span of 12, 24 months. So it has become very, very difficult for our elders to, to go through and to accept this new normal. If you try to understand, in a little bit detailed manner, the disability that they have earned, functional disability, even the psychosocial disorders, what they have developed over a period of pandemic, has become the biggest challenge for the healthcare to handle. Because it is very well known, known fact, and it is very well established that frail holders, those who have a lesser functional capacity, are very prone for risk of falls and even for fracture and hospitalization. And if we try to understand the consequences of the pandemic, permanent affections, like even not only at the psychological level, even at the physical functionality level, it has created such a devastating effect. Not only the mental effect, even the psychological effect, sorry, physical effect of the pandemic. And if you see the mental health consequences also, not only the functional decline, even for the mental health of the elderly population, as a result of uncertainty, anxiety of this very pandemic, has increased their cytokine storming, low-grade inflammation, elevated cortisol levels. So all these things has created such a conducive environment uh, for this inflammatory changes inside the body, so that they, as a result of biological fluctuation, they have developed a lot of psychiatric severity in the psychiatric conditions, with pre-existing psychiatric conditions, and those who were not having any psychiatric pre-existing conditions were also started developing these psychiatric complications like anxiety, depression, or post-stress related disorders, or post-traumatic stress disorders, or even social ideations. There are so many psychological consequences or mental health consequences during this pandemic. And still, the long haulers, what we call it as the COVID complications, or long COVID symptoms or syndrome. Because if we see the projection based on the earlier evidences, because in 2010 they have isolated severe acute respiratory distress syndrome, the COVID-1 variant, it was identified back then. Even based on the identifications of that COVID-1, the permanent disabilities like pulmonary fibrosis, liver function impairment, reduced respiratory capacities. So those were the permanent, impacts which were purely because of this infection. It was documented back in 2010. This gives us just the tip of iceberg that how much this SARS-CoV-2 might have influenced our psychophysiological functioning. Because these are just the projections. We have no clear picture about how exactly this SARS-CoV-2 has influenced our psychophysiological functions. Whatever we are identifying or whatever we are noticing at this moment, it is just the tip of iceberg. So this systemic influence by cytokine storming has taken a very huge toll on physical as well as the psychological aspect of an individual, especially elders, because they were already vulnerable. On the top, they had this infection. So then, what do we need right now? If we try to understand our existing rehabilitation modalities, they are very, very limited, and the amount of skilled employment like skill therapists, when we talk about physical therapy, or even occupational therapists, or even if you talk about medical specialists like specialized physical therapy doctors, we have very limited workforce in order to cater the multidimensional complaints what they come up with. So even World Health Organization and other global bodies, they are trying to develop certain modules, certain approaches for a current problem, like multidisciplinary interventional modules. One amongst those modules would be HEPAS, that is healthy eating, physical activity, and sleep. But again, it creates a very limited boundary for the holistic rehabilitation. We need something called as comprehensive rehabilitation, comprehensive COVID rehabilitation. We cannot just follow healthy eating, physical activity, and sleep, because uh, even though we don't have any specific intervention for enhancing sleep quality, because if you see current approach, we don't have something specific for quality of sleep. Or whatever we have are very superficial, and it requires a lot of resource and infrastructure. Population like ours, it is almost 1.4 billion population, like developing country of ours. We need enormous amount of gigantic amount of infrastructure and skilled employ, employers. So by keeping those things in our mind, if we try to think about the solution, then even though we know everything, we know the magnitude of the problem, we know, at least we have the idea how our approach should be. But despite of all these things, the contemporary society and healthcare providers are not paying, attention towards elderly, adults, or even for the elder population. They have been sidelined. So it is the need of our. If you see the initiatives of the present conditions are like WHO has declared 2021 to 2030 as a decade of healthy aging, because this initiative has been started purely because the global rapid aging phenomena. And again, they talk about it should be like to cater uh, the multidimensional requirement of the elderly population. It should be a collective effort in multiple areas, like changing how we think about their problems, and how we feel and how we act towards age, and even ageism. So the very process of it. And we should develop not only the therapeutic protocols, but we should work on the society level, where we should develop a community-based approach, not just for the caregivers, even for the elders, to foster their abilities to accommodate with new normals of post-pandemic world. And all those therapies should be, person-centered, self-tailored, tailor-made, and those tailor-made, self person-centered approaches should be not, they should not be in a theoretical frame. They should be in a practical approach, which means we are lacking in translating whatever the theoretical frames approaches we have into clinical practice. So those are the lacunas where we need to focus based on the existing experiences, because these are the previous ideas of natural calamities, whether it is Japan's natural calamities or any other natural calamities. The global bodies have like even few guidelines to enhance or to prevent the progression of frailty, the declining of the uh, physiological functions, or overall functional decline, how to prevent it. They talk about keeping them physically active by engaging them in multiple activities. It doesn't mean always they have to get involved in physical exercise. It's like keep going for a walk, or involving in some kind of social activity. It could be charity, service, spiritual activity, or engaging with the family members. Those are the things which will not make them feel compulsive. So they are like exercise along with recreation. It is like fun filled activities. And Very important thing is musculoskeletal complications, kinesiophobia, or even frequent fall, fractures. All these are common musculoskeletal complications. If you see COVID, fatigue is the major complications what we are suffering post-COVID. So, in order to manage COVID fatigue, to maintain better functional capacity, I think this kind of recreational physical activities are very much essential. And having a balanced meal is also very essential because nutraceutical approach is very essential to maintain a better functional capacity and to prevent low grade inflammation and to enhance a better immune function. For that, balanced diet is one of the best way. And they should maintain better oral hygiene because again, frequent infections and proper. Even though if we ingest food without proper mastication, proper chewing, it might go for a waste. So for a better digestion and absorption of the food, they should have a better chewing process. And food should be more of chewy by nature. It should not be too soft so that it gives a better chance for the microbiota to get established. And most important thing is they should have a better family support, especially the social support. Not just the support groups outside, even within the family, they should be well empathized and they should have a better social support so that they should not feel left alone. And I think our next session will be entirely focused on yoga. But I would like to add few insights into it. Whatever the existing rehabilitation modalities we have are not even close to the mark. We need a huge reform in the rehabilitation area, not just the preventive rehabilitation area also, because post COVID we will have a huge slurge in post-COVID complications. So we have to be prepared so that I think it's better to prepare early. Yoga is again, युवावृद्धो अतिवृद्धो वा व्याधितो दुर्बलो अपि वा अभ्यासात् सिद्धिमाप्नोति सर्वयोगेश प्रतीन्द्रिता. Which means there is no age bar. It has been clearly written in Hatha Yoga Pradipika that there is no age bar. Most of the people, especially elderly people, they are so scared of getting into the yoga practice because they think yoga is only for the agile ones. It is not about the agility, age, or endurance. There is no age bar. It has been clearly written in our ancient scripts. Uh, those who consider or believe they are the source of the very science of yoga. It clearly documents there is no age bar. Even everybody, you are Ruddu, Vyaditu, Durbala, diseased, debilitated, older, younger. There is no such thing. Anybody can practice at any age in any condition to get the maximum benefit of yoga. For example, few scientific findings, if you try to see how yoga, especially these are the studies I would like to quote. These are the studies which have been conducted in the geriatric population, elderly population, where how yoga practices can enhance the functional capacity and how we can prevent functional decline. And it's not just a yoga is not just a physical activity or physical exercise form. It is a holistic rehabilitation tool where they not only practice it, but meanwhile they enjoy and perceive it to be appropriate because the study is clearly documented the subjective experience of yoga practice and people who practice, especially elders, they enjoy the very process of yoga practice and the perseverance of the practice was very high and they do enjoy practicing. About the chronic musculoskeletal pains, even polyarthralgic conditions, the overall aerobic fitness, and even when it comes to strength, mobility, and the balance, kinesiophobia, all those parameters which we generally consider for assessing functional capacity have greatly improvised after yoga practice. And these are the studies which are not done for a prolonged time. These are like short interventions for 1 month, 2 months, and 3 months. None of these studies are beyond 1 year. So even very practicing for a limited period of time could enhance a great transformation in the physical capacity of elders. Because of the COVID, they are not able to get out of the comfort zone or going out of the house, and keeping them engaged in physical activity was the challenge. But this yoga can be, of course, implemented within the indoor areas, so it has no boundaries. When we talk about the mental health influences of yoga, uh, whether it is a GABA levels and anxiolytic effect, antidepressant effect, all these things, along with that promotive effect of melatonin secretion when it comes to geriatric population, because COVID has hit them very hard from the psychosocial perspective as well, not just the physical perspective, but the psychosocial perspective about uncertainty, anxiety, even the post-stress, stress-induced, pathological things. Apart from that, the very, fear, the coronaphobia, because they feel they might become victim for the repeated infection of COVID. And yoga practices have been evaluated in this area also. How yoga practices can actually enhance immune modulation. There are studies where antibody titer in response to vaccination. This is something very, very interesting, which got me through, because most of the people, because we all are vaccinated, almost two shots, and now people are going for booster dose, especially after the age of 60. Healthcare fraternity is promoting elderly to go for booster doses of vaccination. If we add yoga practices, the very efficacy of the vaccination for influenza, but especially when corona is also under the same category, the vaccination efficiency can enhance through yoga practice. So that has been studied through antibody titers. That is something very promotive. Can make better use of vaccination process. And even the studies shows that high levels of CD3, CD4, and CD8, T lymphocyte, all these special lymphoid cells, which are the markers for enhanced immune function, like better immune vigilance, and even the better production of phagocyte functions, or even the cell-mediated and humoral immune response. All these things are very, very supportive, not just for prevention, even for symptoms. And sleep is something which has been greatly compromised. And as I said earlier, we don't have a better, treatment protocols to enhance quality of sleep, especially elderly or even in younger adults. There are so many studies even about the influence of yoga on positive influence of yoga on obstructive sleep apnea, and how yoga can enhance the quality of sleep by reducing the fragmentation of sleep, disturbed sleep, better efficiency, sleep efficiency, and even the post sleep refreshing experiences. So all these things collectively, support the very beneficial effect of yoga, even as an comprehensive rehabilitation tool for post-COVID population. And the anti-inflammatory effect of yoga has also been documented. So there are so many evidences to support whether we can effectively make use of yoga as a comprehensive rehabilitation tool. I am emphasizing yoga because right now our rehabilitation sector to handle post-COVID complications is not in a very good position. So we need to make a better. We have to organize ourselves. We should keep ourselves open for all the positive impact of traditional as well as conventional approaches to make a better treatment outcome. Safety-wise, again, there are studies which clearly says yoga has been very safe even for people with disabilities and even with the elderly population. Based on the requirement, this is the rated yoga model. They can make use of it for the rehabilitation purpose as well as for the prevention, even because people are talking about the fourth wave, because these waves and these chronophobia, the very experience of pandemic is traumatic. So this module can help geriatric population to overcome the fear. So I think I would like to stop here. Thank you very much. Uh, if there are any questions, I would like to take questions. Thank you. I think that couldn't see any questions in the chat box. Well, if there are no questions, then I would request the organizer to proceed further for the next session. Thank you. Jaivan.
Thank you, Dr. Vijay, for such an insightful session. Much needed topic because elderly population are the most ignored. We have one question from Sujata. Can you please share more about the module? How much time should the elderly practice the protocol?
Thank you. Thank you very much for the question. When we talk about yoga module is just for one single session, and they can fragment it any number of time they can. There is no set frame or time limit for the practice. For example, they are sitting and watching TV. They can just sit relaxed and they can do pranayama for 15-20 minutes. Even simple deep abdominal breathing could suffice. So there is no such set rules that they should practice this module only for a certain period of time. They can make use of these practices whenever they can. There are no such restriction. Only thing is they should be in a empty stomach, like at least 2 to 2.5 hours post meals, 1 hour after their liquid diet. That would suffice the meal. Even if immediately after food, if they want to just lie down and they want to do relaxation technique like deep relaxation technique or yoga nidra or even vipassana dhyan or breath awareness. Those are the practices. They have no contradictions. So they can be practiced anytime. So moreover, what we need to make them understand is it is not just the modular protocol or the set practices to be practiced. They should make use of the entire philosophy of yoga into their day-to-day life so that wherever they go, they can make use of yoga practices, not just the physical practices, even the very psychological constraints, even the philosophical insights of yoga can be make use of uh, you know, make they could be made use in their day-to-day life. There are no certain set rules. And what do you suggest for gout disease? Again, gout is excess accumulation of uric acid. So for that, we need to have a better hydration and reduce protein intake. More so, dietary restrictions like dietary modification could, solve most of the gouty or even gouty arthritis are very gout complications. So, better hydration, avoiding fruit-rich food, reducing excess protein intake would suffice. Have a lot of fruits, a lot of greens, and take good amount of water. Like even alkaline water, we can make alkaline water by adding slice of lemon into a drinking water, or even a piece of cucumber into a drinking water. That helps you, with a great deal. So Thank you very much. Thank you. I'm, I'm sorry, I don't know the question.
There's one more question.
Yeah. Older people usually have joint issues like knee pain and back pain and can't do some of the asanas mentioned in the module. How to approach? If you could just see the module, I've written one sentence in the last, like if those who cannot perform these practices, they can make use of chair yoga. Means they can make use of the chair as a rod. They can practice even Surya Namaskara in the chair. Many of the practices can be performed with the help of a chair. So I think that would be beneficial. More psychological impact than others. That should be old age function. I think indeed it was very difficult for even healthcare providers to address the issues of elders who are dwelling in elder old age homes, because during the pandemic they've been ignored uh, uh, for a greater extent. If we want to help, as I said, it's better to develop a healthy social environment for elders who are in old age homes, not just providing them, a few asana or pranayama. It's better to have them healthy, interactive community. They should made, involved in even simple laughter club or even philosophy discourses or bhajan, satsang. So these are very simple but very effective in order to inculcate positive attitude towards life. Because in the dawn of their life, it is very normal to feel depressed and pessimistic. But by adding these few support community practices, we can inculcate positive attitude and optimism in elders, especially those who are in old age home. There are no further questions. Hope I answered all the questions. Thank you very much.
Thank you, Dr. Vijay, for such an insightful session. Health and mental health, physical health, and elderly has been the most neglected till date because we feel that they are retired, they know everything, they know the ways of life, so we don't have to bother checking in on them. But unfortunately, it's too late by the time we realize that we should have paid more attention. And oftentimes, symptoms of depression in elderly have been confused as symptoms of dementia. Dr. Nagratnam has helped me understand such things a lot better. So moving on to our second session for today, we have with us the great Dr. Nagratna. She will be talking to us about yoga for elderly beyond exercise. So I know Dr. Nagratna doesn't need any introduction. She is the mother of yoga therapy, but I will still go ahead and give a very brief introduction. Dr. Nagratna is one of the pioneers in the field of yoga therapy. She is the director at Arogyadhama SYASA. She did her MBBS, MD in internal medicine, MRCP and FRCP. She has innumerable publications to her name and has 11 books on series of yoga for different ailments. She is a recipient of many, many, many awards. She has treated lakhs of patients and is in the truest sense and form a true healer. So over to you, doctor. We welcome you to today's webinar.
Yeah, no, it's possible. The host that were not, yeah, maybe presentation. Yeah, share presentation, share screen.
This is the one.
Yeah,
Okay. This looks
share screen.
good.
Is it visible? Is the screen visible? Yeah, slideshow down there.
So,
Trying to put it on slideshow. Yeah. थोड़ा इसका explain कर- Okay. Namaste. Namaste to one and all, bringing greetings from Swami Vivekananda Yoga Anusandhana Samsthana Yoga University, Indian Yoga Association, Vivekananda Yoga University based in California, USA. Greetings from the Ayush Ministry to all the yoga lovers in the world at large, in Lakulesh University in particular. I am very, very pleased to tell you that this year has been great in Karnataka because Karnataka, the palace in Mysore was chosen as the site for the national level Yoga Day celebrations, where our Prime Minister Narendra Modi ji addressed the gathering with 12,000 people doing the yoga common protocol in front of the beautiful palace in Mysore. I request all of you to have a look on the YouTube for what has been beautifully expounded as a celebration. Friends, 8 years have passed with the International Day of Yoga, and we are seeing the whole world embracing yoga as if Mother Bharat has embraced them all with this beautiful knowledge of yoga. And may I tell you, my dear friends, that just before this thought of International Day of Yoga was propounded by our Prime Minister Narendra Modi ji in the United Nations, accepted instantaneously by 140 countries, which has spread to more than 200 countries. Just that logo had this concept, yoga is for health and harmony. This changed the whole understanding of yoga. Just that one logo, 2 words introduced under the logo, changed the whole understanding of the concept of yoga, which was being taken as a fitness training program for reshaping their body around the globe, although it was not what yoga was meant to be. Yoga does improve the fitness. Yoga does help you to shape up the body. That's a small benefit because yoga is holistic, total, emotional, social, intellectual, and spiritual level. And this is something which can be practiced from by children, adolescents, adults, and the elderly. So it is very, very up that on the occasion of this International Day of Yoga, our Lakulesh University has planned this symposium where you have heard Dr. Vijay who is the pioneer, who heads the Department of Yoga Therapy in Lakulesh, has given you a beautiful overview of what are all the research components that have already been looked upon, and there is a lot more to understand. I hope he has already triggered your intellectual brains to go more into it, read more about it, understand about it, and start doing research in this area. I bring greetings again, the loving greetings from all the faculty and friends of Vishwasa to all the students, faculty, children, and my pranams to the chief of the organization who has made this university their dream come true for Gujarat. What I hope to do in the next few minutes is to see how important it is for elderly people to introduce, add on yoga into their life for healthy aging, whether it's poor or the rich. There are three types of aging. We all know one way is the chronological age. You may be 65 years, anybody above the 65 years are classified as the elderly, but you may be 65 years or 70 years or 80-year-old at the age of 50, or you may be 50 years young, even at the age of 85. Just this morning, I was addressing the group of one of the universities in Bangalore. The founder is 84-year young, and he's the youngest person in the campus, runs about, moves around, and they're celebrating the 50th year of their university with this young 84 chancellor running around in the campus equal to all the youngsters, and he participated in the Common Yoga Protocol program. So chronological age, depending on your date of birth, may be defined as aging if you are more than 65. But what is very, very important is the social aging and the psychological aging, which we go through. I request all the youngsters to read this book, Ageless Body and Timeless Mind, by Dr. Deepak Chopra, who is considered the guru of medical yoga in America. He wrote several books. This was one of the early books. As you start reading this book, my dear children, you will see that you are already feeling 10 years, 15 years younger. What he describes in that is, let us compare our body to Ganga River. Where does the Ganga River take its origin? In the Himalayas, and then ends in Kolkata in West Bengal. And all the way miles and miles of Ganga River. How old is Ganga River? We don't know. They say that Ganga River was brought to the earth by Bhagirath for purifying his ancestors' Atmas, thousands of years old. What Deepak Chopra beautifully asked you a question is, my dear friends, take any drop of water from any part of Ganga, whether it is at its origin or at its termination. How old is the water? At its origin, it may be 1 day old. At its termination, it may be even 3 months old if it is stagnated and not run through directly. But it cannot be more than that. Is any drop of water as old as the history of Ganga River, as old as Ganga River, maybe 10,000 years old? Certainly not. So our body is like that. Every cell is like a drop of water in the Ganga River. Every cell is going through a cell cycle, which has got a gene programming, and this program is fixed like a software program for each and every cell. Your heart cell may be, as a new cell is being born, it lives so long and it has to dissolve itself, which we call as programmed cell death. It is programmed already. Birth, live, die. Born, living and dying. This cell cycle is programmed for every cell. Different cells have different types of programming. Red blood cell may be 188 days. Your buccal mucosal lining cell may be 1 day old. Gastric lining 12 hours old. So it is continuously being renewed. As you started this seminar, when you started listening to Dr. Vijay, and before the end of this session, already 90% of your cells would have replaced itself. There is an eternal turnover, which is constantly going on. And there are spurts of rapid growth, faster growth, and larger number of cells getting into this program when you are in the growing age, and the cycle duration, say for example, red blood cell cycle is 100 days, whether you are 5 years old or 50 years old or 100 years old. The cycle duration does not change. But there are other growth factors which can come and stimulate the number of cells increasing or the number of cells decreasing. That's all. So your cells have exactly the same cell cycle, same duration, and the cells are continuously on the change, on the recycling, and no cell is as old as you are. And what does the new knowledge tell us? The new knowledge tells us is what makes you decrease the number of cells or increase the number of cells depends on the social factors. The social aging is what problems do the elderly people face in the society, loneliness and isolation. And today we have lost the joint family system, and that loneliness and isolation, etc., have become one of the major issues. Retirement shock is a big thing that most of the people experience. If you have been a very busy person throughout your life, a professional, working, achieving deadlines, targets, growth, lot of money, lot of name, lot of fame. I remember one of our doctors who was also attending yoga classes, was very much into spirituality, who would do his daily puja and do his yogasanas, do his philosophical understanding, etc. But he was he was a dermatology professor, and he suddenly landed in our ashram when he was 65 or so, and he was so depressed. I asked him, sir, why are you looking like this? Why are you depressed like this? I have come for treatment here because I got into post-retirement depression. I never thought that life would become so blank, so vacant, and so dull, and your life workplace. Once I came out of my job, I know all this. I have studied Vedanta, I am doing yoga, but still my mind is not able to accept this non-involvement, non-acceptance in the society, no job to be continuously running. He said something very interesting. See, I was a professor at the university college. As soon as I put a stethoscope for where my doctor's coat and enter the hospital, there will be a large number of people running behind me, patients running behind me. I let to say, wait. Students run behind me. I do ward rounds, run around in the hospital. Everybody is running behind me. I'm on great demand. The day goes and I return home at 8 p.m. and I am so tired and exhausted. And the family is waiting for me. Patients are waiting for me. Clinic is waiting for me. I'm always on give, and my eye was getting so much boosted up by the name fame. He was a very good doctor, very caring doctor, very loving doctor. But Post-retirement, I am totally getting into this feeling of life being not worth living. This is where Deepak Chopra goes on to tell us how Indian system recognized this and divided the lifespan into immediately after your retirement, you have to enter into Vanaprastha. Then you enter into Sannyasashrama. What is Vanaprastha? Where you start giving this knowledge free of cost, free of earning, because all your family commitments are over, your family is settled, and you become retired and you start learning a new profession. What is the new profession recommended in the Indian system of the 4 ashramas of life? You start learning the scriptural knowledge, the life mission, yogic knowledge, which is the real culmination of how a person can establish a balanced, healthy, happy, stable, blissful life in the midst of all the problems that we may go through. Is the spiritual life that one has to go start getting into, and this is the new profession that our sages recommended. When when you retire, so full time from morning till night, start with Veda chanting, then this asana, then pranayama, then puja, then go on a walk, then go to the gym, then come back, do some consultancy practices, get into some selfless karma yoga practices, because financial settlement has happened, children have settled, they have moved out of the house, you are just the two at home, and this type of single unit families today, you are feeling isolated. Therefore, you get involved in a daily routine, and then by evening start again studying more scriptures and more bhakti yoga. And by the end of the day, you are already through for the preparation for waking up early in the morning, go to bed early, have a regular lifestyle is very, very important. As I have written there, 80% of our online MSc yoga students are software professionals and housewives who have reached a level in their life about 50, 60 years, and they want to find a new profession to keep themselves busy. Plan after children, settle down, pursue hobbies, and finish important jobs. Vanaprastha, selfless seva. How to maintain our wellness through yoga is to start incorporating yogic techniques to maintain wellness at all levels, and techniques at all levels should include physical level diet, cleansing techniques, physical postures, breathing techniques, dharana, dhyana, samadhi, the meditative techniques, devotional sessions, bhakti yoga, and Vijnanamaya Kosha, the notional correction, happiness analysis, and deeper understanding of the purpose and meaning of life, and introspecting and deleting all the past hangovers. In fact, many people say that after retirement, I started going inside. The outside attractions do not bother me anymore. There is so much joy in understanding my own mind, my own physical system, my own body, and my interaction with the world outside, and going deeper, 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 understanding and recognizing the prana processes that happen in the body and the processes that happen beyond all these, going beyond the intellect, is Jnana Yoga. And that's the entire knowledge base of Upanishads, Vedas, etc., which is a fund of knowledge which we can understand for ourselves, for inner growth. What is the purpose of this inner growth? To lead a healthy and happy, contented life, removing all the expectations. Just yesterday, I met one person, elderly person, her biggest problem is expectation. I expected children from America to call me every day 2 times. I expect my husband to care for me. I expect my daughter, who is busy in her own activities, to come every day. She doesn't even say hello to me if I call her. This expectation is a big, big issue. I'm reminded of a very beautiful example that our Monji always used to tell to the such elderly people. He would give a beautiful example of a bird. Mother and the father bird create a nest, lay an egg in the nest, and they give the warmth. One of the birds give the warmth to the egg, and the other bird goes and brings food, protects the egg from wind, rain, etc., and gives on giving warmth to the egg, and the egg hatches. When the egg hatches, the little one comes out, and the little one can't even open the mouth. The mother bird is opening the mouth. The father bird pushes the worm into its mouth so that it learns to eat and swallow. Then slowly, the feathers are coming up. Slowly, the feather grows. And on the day when the mother feels that the baby is ready, what does she do? She pushes the bird out of the nest so that the feather can open up and it can fly. Maybe 1 or 2 days it will fly a short distance, she will support, and then next day it is free to fly wherever it wants. And our Monji always used to say that, does that mother bird expect that that little bird will come back and take care of her in the old age? If animals and birds do not expect that, why should we as elderly people expect our parents, our children to take care of us? I've done my duty. I come out of my moha and I release all my commitment, and I learn how to be recognizing that inner freedom, inner confidence, inner courage, inner aloneness and not loneliness. Enjoy that ekante sukhamasyatam. Enjoy that aloneness is what is to be practiced in the Jnana Yoga. Then seva, unity, fear of dependence. These are all very, very stressfully challenging situation. For all these, we have reacted, suppressed, long-standing, persistent, suppressed emotions, frustrations, anxieties, fears, which have percolated into the body as diseases or stay back in the mind as depression or anxiety. For all these, sages said only one word. Have you practiced yum yum yum? Mind is the one which creates all these problems. What is yum yum yum? Mastery over the modifications of the mind, or mastery over the monkeying of the mind. That is the purpose of yoga. What yoga is defined as by Patanjali is Chitta Vritti Nirodha. Chitta is the mind, Vritti is the monkeying or the modification, and Nirodha is the mastery. If you have practiced yoga right from childhood, from adolescence, with the right understanding, then you would have already developed, cleared all the backlogs of anger, fear, worry, tension, depression, gone on with a very stable life. But if you have not done that, because you are waiting for the retirement time, now at least let us take it up and see that we start practicing this MMM. And for that we saw how all these practices at the physical level, breathing level, mind level, emotions level, etc. can be utilized. So let us quickly run through some of the common problems that we see with aging. Hearing loss, impairment of hearing, impairment of vision are all common sensory impairments that we see. So apart from doing the integrated program that Dr. Vijay showed you, which includes some sukshma yamas, asanas, pranayama, meditation, relaxation techniques, doable based on the capacity of the person based on the background comorbidities. Specific modules are available, but all of them include all these: healthy diet, cleansing techniques, asanas, pranayama, meditation, relaxation techniques, etc. So included in this integrated approach, if there is hearing impairment, hearing loss, we give emphasis on pranayama practices such as Brahmari and Brahmara pranayama. What is Brahmari pranayama? Brahmari is close all the openings and then do low pitch humming sound. Brahmara is when inhalation you do high pitched humming sound, high pitched B sound, which gets the stability in preventing hearing loss and helping in hearing loss also. Eye problems again, cataracts, errors of refraction, age-related macular degeneration, diabetes, hypertension are the commonest causes for eye problems as the age advances. And for this also, we have to develop regular reading habits for prevention, avoid over bright light of the screen, and regular practice of Trataka, both Jatru Trataka and Jyoti Trataka. In addition, regular practice of Sun Trataka also will be very, very useful. But please ensure that you never do Trataka or focusing on the bright white sun, early morning and late evening, golden yellow sun, which will be only 2 minutes is the whole of the understanding. But I don't know in the present day city life whether we can really see sunset and sunrise. For glaucoma, Trataka can be very useful. Many people are teaching you that Trataka is contraindicated for glaucoma, but please remember that for glaucoma, Trataka can be done and it is useful. For retinal problem, avoid acute pains, acute dynamic practices, and help them to continue the eye practices along with all the other practices. Back pain, neck pain, and osteoarthritis, musculoskeletal problems. As each one of these practices, there are specific modules. Please consult the yoga therapist, consult the group who are guiding you to give you the specific modules. You cannot do the same asana for all diseases. It's just like one single tablet cannot treat all diseases. There are different sets of practices based on the concept of yoga, which says local, deep, conscious rest to the sick organ where the activity is locked up as an inflammation. It is to bring your awareness by doing a little stretch followed by relaxation. Stretch, relax. So even in osteoarthritis, if somebody has got any pain, you ask them to stretch the knee, feel the gentle pain, relax, stretch the knee, relax, stretch the knee, relax. So that becomes a special technique for the knee pain. So osteoarthritis is one of the common problem. In fact, we admit large number of patients who tell us that I have been advised knee replacement. I would like to avoid knee replacement surgery, and therefore I have come here. And we find that they come limping and they go back running. Is a very common experience in our campus, because when they do this intensive integrated yogic stretch followed by relaxation, 3 things happen. The local inflammation reduces, and what is caused was the lifestyle, the past lifestyle, which was causing the early aging problems. Obesity we reduce, and the injured joint would have caused the problem, and therefore we promote them to do all these practices such as simple Sukshma Vyayamas, then Shakti Vikasaka Sukshma Vyayamas, which help them to strengthen the muscles around and then relax. There is a beautiful concept from Mandukya Karika which says there is enormous locked up pranic energy in the sick part of the body where there is a pain or inflammation. So bring your awareness with closed eyes deeply and then focus your mind intensely and then relax that part. And that is what Patanjali beautifully explains when he talks about Prayatna Shaithilya Ananta Samapatibhyam. So you bring the awareness to the sick joint where there is a pain by moving a little of the joint to a level of partial pain, tolerable pain. Enjoy the pain, hold it in that position, and then we'll go stretch, relax, stimulate, relax. So this way we bring in local deep relaxation to the joint. That's not enough. We have to go diversion of the prana, diversion of the energy to other parts. So holistic approach, entire body movements have to be encouraged. Then we do slowing of the breath, pranayama, then mind management, lot of counseling to help them to undo all their deep-seated stresses. I'll give you an example. One elderly lady in her 65 year had come here. She was having persistent ankle pain. Very good lifestyle, healthy lifestyle, no obesity. She was not really having any extra wrong lifestyle things. Very traditional family, good husband, good children, all happily settled, no cravings, very good sattvic lifestyle she was leading. And she came here, she was doing all the practices, and then the pain did not go even after 2 weeks, although it reduced partially. One day we sat and we discussed with her, Madam, please think of what could be the deep-seated stress in your lifestyle that you may have suppressed, which is now stuck in your joint at the ankle as a painful inflammation. She said, Madam, I am such a happy person, so contented a person, such a good family. I don't think I have any stresses. I am very contented, God-fearing and God-loving person. I have a very healthy lifestyle. I'm a really happy, contented person. And then she went on for a few seconds and stopped her thought. I got it. When I was a 12-year-old girl or 10-year-old girl, there was a very bad event that happened in my life, which is even now bothering me. If you ask me, think of all the stresses you may have gone through in your entire life. I had a very bad experience with some bad treatment by a person in my life, which is bothering me even now. Sometimes in my quiet moments, although I have grown, I have done a lot of bhakti, a lot of sadhana, a lot of Vedanta studies. Even now that keeps cropping up in my mind. But now if I look back, now that you have mentioned that could be the cause for my present ankle pain at the age of 65 years, I am going to work on this. So she took one more day, 2 days, and she went on recapitulating the entire event that happened in her life and how she was angry, how she had to suppress her anger, how she could not express it to anyone, but it was bottled up in her brain, bottled up in her heart. Anyway, to erase this memory which are bottled up, Deepak Chopra beautifully tells you very interesting things. Where is the memory, my dear friend? He asks. Is it there in your brain cells? If you break your brain cells, can you find any memory? He said it is in my heart. Where is it in the heart? Is it there in the physical heart? No, it is my Manomaya Kosha, which is all there as a field. And I am continuously downloading my fears from this field. And all that I need to recognize this is just go into that field and disconnect itself and not download it. So the memory is there somewhere in that field, which is not inside my body. And I am downloading, keeping it alive. So I stop downloading. Then I don't have to worry about it. So this lady understood this. And she said, now with all my new knowledge, I can do kshama for that person who mistreated me, who mistreated me. I gave to him my head out of anger. Can you believe, my dear friends, within 2 days, her pain was completely gone and she was able to run around. So working at all levels is so very important, is what I want all of you to understand. Back pain and neck pain prevention management, integrated approach of yoga therapy, special techniques. 4 important practices are Pavana Muktasana lumbar stretch, folded leg lumbar stretch, crossed leg lumbar stretch, Setabandhasana lumbar stretch. Many elderly people go through physical balance problems. Most of these physical balance problems are also big, not only because of the neurological deficit that happens in one of the balancing maintaining centers in the brain, but due to muscle weakness because of inactivity. So strengthening all the muscles through balance by Sukshma Vayamas, starting with simple Sukshma Vayama, followed by Shakti Vikasaka Sukshma Vayamas, which are doable harmlessly for heart, etc., are going to help them to improve their balance. Then pulmonary problems, asthma, interstitial lung disease, chronic pulmonary disease, obstructive pulmonary disease, cardiac failure. Because of the long-standing smoke, they would have developed COPD, emphysema. Today, you can see many elderly people who are having to have home oxygen therapy because of the lifestyle that they have led through, and therefore prevention, because of their difficulty, they may not be able to do many of the asanas like the youngsters can do. So there is chair yoga, chair surya namaskara, and I'm sure you're all understanding it is mind management. You don't have to do a particular asana to cure a disease. Only one thing that one has to do to cure a disease is mind mastery. Be intensely free from. The last thing is the fear of death. If the fear of death completely goes, then diseases can be cured. And I'm talking about fear of death, cancer. Again, a very common problem in the elderly. I have not put the slides in this because this is one of the severe conditions which is not being talked about in this presentation. Cancer, major heart diseases are all cases where we use just this one concept. Somehow make the participant go into that absolute fearlessness, like a winning warrior who goes to the war and comes back. How does he go to the war? He goes to the war saying that I may not come back. People put tilakam and send him to the war, knowing fully well, including the children, mother, the wife. They put the tilakam because they know that he may not come back. That means everybody has accepted that he may die in the war. He has accepted that he may die in the war. But who is a winning soldier? Who is a winning warrior? He says, I shall never give up and I shall never surrender, succumb to my death. I shall escape death and come out of escape death by winning the enemy. These are the confidence of inner immortality knowledge that we have through the scriptural knowledge that helps people to survive this cancer and major diseases also. Okay, we have yoga chair breathing and different steps are there. As Vijay was talking about, depression, anxiety, agitative depression are very, very common. I remember one of my own relatives went into depression in an elderly age. And of course, as usual, he was to be given some medications to come out of his deep depression. And within 4 months, he came out of the depression and he could stop all medication. Elderly people who went into agitative depression, coming out of antidepressant tablet is not a common thing at all. We'll have to give them long-term medication. And when he recovered, I was asking him, sir, what do you think helped you? How could you come out of your depression so quickly? He said, do you think, Nagratna, the tablet helped me? It was my Gayatri mantra that helped me. I was used to doing Gayatri Japa all my life. And when this depression took over me, although I was not interested in doing any outside activities, I became morosive. But inside, Japa was continuously going on, continuously going on. I would be lying in bed, but continuous Japa was going on. Gayatri, Gayatri, Gayatri Japa, Om Bhurgo Swaha. And through that, it helped me to completely come out of the depression. So these are wonderful examples that we see in our life, which helps us to recognize the amount of healing power that we have within us. Aging of brain cells, dementia, Alzheimer's has become a very common thing because we are living longer now. There was a time when the life expectancy for Indians were in 40s and 50s. Today it has come to 65, 70. So more and more people are surviving longer, brain cells becoming aged, degenerating, losing of nerve cells, to and going on to memory impairment is a very common problem, and failing memory for recent events, time-space orientation are usually very common. So prevention is better than cure. One of the most unfortunate thing that has happened in present day growth, the fast life that we have gone through is in education system, memorizing is not given importance. Everything is available in your mobile, everything is available on the computer. Why should I remember? Even we, you and me, we used to remember maybe 30, 40 phone numbers, but not even the husband's phone number we can remember now because it is all there in the mobile. So this way, using memory as a tool in education is totally replaced by only intellectualizing, logical thinking. We felt that why should we waste so much of time in memorizing poems, memorizing formulae, memorizing data. Instead, we shall memorize, we shall use that for more logical thinking, more intellectual development, more IQ development, which is also necessary. But what is the price we are paying? Memory failing at an early age has become a very common thing, and Alzheimer's catches up, and memory becomes a big, big problem. And therefore, education, memorizing is a very important thing in education. So when we see people in early Alzheimer's, dementia, we repeat shlokas, stotras, memorize the old shlokas, stotras, and old thoughts that they have learned, repeat it every day several times, and learn to memorize one new line every day, apart from the regular integrated approach of yoga therapy, where we go into stress management through asana, pranayama, etc. So only solution is we should go back to our joint family system where our parents are taken care of with good amount of acceptance and respect. And Deepak Chopra finally comes to the Indian system where he says, as you are aging, you become more respected in the family. Your people come and touch your feet and they want to Ashirvadam. You are wanted in all the celebrations. They are wanted in all the marriage parties, in all the temple activities for blessing others. And people are respected more as an aging, as you go on aging in the Indian cultural society, which has evolved over thousands of years of experience, my dear friends. This always makes me remember when I used to be in UK, there was a surgeon who was 90-year-old, and one day he went and shot himself in his bathroom and killed himself. I found out what was the reason. He was a very well-known surgeon. There is a surgery named after his name, but after retirement, that vacancy, that blankness, that depression, he couldn't accept it. Like I told you the example of our dermatologist. Whereas in India, we have got a long way to go through Anaprastha and Sannyasashrama, where we recognize that wonderful, blissful existence. To end the program in my presentation, let me give you a small anecdote what happened in North India. Alexander had come to India, and when he was coming, his guru had told him, when you come back from India, you are not going to invade India. When you come back, bring back 3 things for me. One is a Ganga water. Number 2, the peacock feather. Number 3, bring a yogi. Peacock feather because it represents Krishna, Bhagavad Gita, and yogi. So he collected the peacock feather and the Ganga water, and he requested a yogi to be brought. Yogi was sitting under the tree, beautifully, blissfully meditating and enjoying his bare body with enjoyable, blissful state under the tree, and helping people, loving people, giving people the right knowledge and good number of shishyas. And the Raja, who was a friend of Alexander, brought and told him, please come, I want to go. Our Alexander wants to take you to his country. The Rishi laughed and said, sorry, I'm not interested. Please go. Then the message went to Alexander, and Alexander sent his army. They also could not do anything. And Alexander came himself and requested him, please come to me and come with me. My guru wants to meet you. I'll take you to my country. I'll give you so much luxurious things. I'll give you this much money, that much money. He laughed and laughed and laughed and said, sorry, I cannot come with you. Then he threatened him. And then also nothing happened. Then finally Alexander realized, how could this man be so happy in spite of it? And understood the whole thing and said, sorry, sir, I understand now how you are, nothing can provoke you, nothing can instigate you, nothing can stimulate you, because I see so much of bliss in you, so much of contentment in you. Touches his feet and requests him, please take a small gift from me, because you have become my guru now. I have understood that life is not just accumulating, and money, name, fame is not everything. I see so much contentment in not wanting anything. Shrotriyasya cha kamahatasya is a beautiful statement from the Upanishads. Then they said, no, I don't need any gift from you. I don't need any Guru Dakshina from you. I don't need anything. It's heartfelt. No, sir. Please accept something. If you are so keen, you do one thing. See, you're standing in front of me, you're blocking the sun rays, which is falling, just to fall on my body. Little cold I'm feeling. Please move 5 inches this side. This is enough of a gift for me. That is the type of contentment, that is the type of joy, that is the type of ananda that one can reach. And how can any happenings in the world can upset an elderly person. That as we age, we should see that we go into the deep, blissful, infinite ananda, infinite bliss, full of contentment, full of peace, abundant tranquility. That is our true nature. This is what our Upanishads tell us. This is what yoga leads us to. And let us nurture this concept and establish ourselves and see that we end our life very, very happy and contented and blissful. Thank you. Namaskar. Once again, remembering this International Day of Yoga as a great celebration. I bring greetings and congratulations to all our friends at the La College University. Think I overshot my time. Sorry, Sana. Dhanyavad. Any questions? If time permits.
Any questions? Okay, looks like there are no questions. Just give me a moment.
Hello, good evening, ma'am. Ma'am, I
Yeah.
have just a question that I have seen so many people working until death. It's like 80s, 90s तक काम कर रहे हैं और ये अच्छा तरीका है खुद को बिजी रखने का. So do you think ये चीज काम कर सकती है उन लोगों के लिए जो बिलीव नहीं करते केवल्य और जो मोक्ष की बातें हम करते हैं उनके लिए? तो 80s, 90s until till death तक काम करना अच्छा है?
No, not that they should be doing a professional job or pressurized job, stressful job. What is happening in present day lifestyle? As we go on becoming seniors in our profession, we get more and more responsibilities. And when you're even in your 50s, the responsibility becomes that it becomes very, very stressful. I always keep telling senior managers, senior executive company directors that only non-solvable problems come to you. छोटा प्रॉब्लम आपको नहीं आएगा, जूनियर सॉल्व कर लेंगे. जब प्रॉब्लम सॉल्व नहीं होगा उसको सॉल्व करना ही है. To do a lot of stress, and if it doesn't get solved, you're in lot of tension, and therefore this committed professional work definitely has to be converted into non-committed seva type of activities after retirement. Therefore, recommend people to become consultants rather than employees as they go on into higher levels of professional responsibilities as they aging advances. Therefore, the best thing is after retirement, if you are not going to be a consultant in the same profession, change your profession and learn something new, something totally different, which you wanted to do all your life. People go traveling, pilgrimages, people do seva in temples, people do construction seva, people do teaching seva, learning yoga seva, as I told you. Many of our seniors have become yoga teachers. I know of a 90-year-old person in Bangalore who continues to do yoga teaching at his convenient hours. So without stress, without pressure on the time, without pressure of somebody demanding on your for performance, and it should be enjoyable, resourceful, and giving you that trupti inside. Definitely we have to keep ourselves engaged, otherwise it is not going to be easy to carry on with our life. That's why there is no retirement age in UK and USA. You can go on working as long as you want.
Akshita has a question. What form of intervention for bedridden elders can be given?
Bedridden elders due to what? Some disabilities. Then we design specific techniques of selected from the integrated approach of yoga therapy. We use some simple body level body level practices combined with breathing, combined with chanting, and lots of meditative techniques, and lots of recorded audio instructions to be practiced even within the bed. In fact, we designed 5 different modules with very simple breathing awareness, meditative techniques, and relaxation techniques, and we call it as yogic ventilatory technique for COVID patients who are bedridden, because ventilation word became very popular in those days. So yogic ventilatory technique for people who are in the ICUs. We prepared yogic videos and sent it over to them. In Italy, they used it a lot and they get recovered. In fact, I am remembering one of the doctors from Italy wrote back and said, 92 of my colleagues died in COVID, but I survived because of Bharat, because of yoga knowledge that I applied. Lying in that ICU bed, thinking of death, my mind was getting stuck. I just deleted that and started doing just breath awareness, and recognize that concept of immortality, absolute freedom from anxiety, and I could recover. So even bedridden acute ICU patients, we can give them simple techniques of mind management, my dear friend.
There's one more question. What is the best way to settle old animosity, talk or forget, or ignore the incident?
See, we have learned to ignore. Ignoring is suppression. See, there are 3 ways we can respond to a very difficult, provoking situation. One, express it, blast it off. गुस्सा आ गया, blast, बुरा शब्द use जो खराब शब्द आता है सब बोल के वहीं खाली कर दो. This is animal way. The other common way that we all do is to try to ignore that animosity. Ignore का मतलब suppress हो रहा है. We are suppressing. This is where we have to learn how to, with all your present knowledge, you open up their emotions, recognize what is that emotion, and then use a replacement of kshama. See, the most important project that helps people is, if somebody has hurt you, somebody has ill-treated you, somebody has behaved very badly with you, problem is with that person. It is not you. Why should I get reactive? It is my I-ness, my ego, which was creating my problem for myself. If that fellow is behaving badly, it is his headache. In fact, हमारे यहाँ एक आदमी आए थे, उन्होंने बहुत स्ट्रेसफुल में थे. उनसे मैंने पूछा, आपने ऐसा सिचुएशन को कैसे हैंडल करते हैं? He taught me this. He said, Madam, why should I get upset? If that is a problem with him, let Hanuman take care of him. मैं हनुमान को छोड़ देता हूँ. मेरा अंदर क्यों मैं रिएक्ट करना, मैं क्यों एनिमोसिटी डेवलप करना, मैं क्यों गुस्सा डेवलप करना, मैं क्यों हर्ट होना. मैं हूँ. उनका तो जो पूरा बिहेवियर है उसको हनुमान से पूछ लेता हूँ. मेरा डायलॉग 15 मिनट हुआ उस आदमी से, 10 बार हनुमान का बात लेते थे. तो हनुमान को छोड़ देता हूँ. हनुमान, भगवान हनुमान देख लो उनका, मैं हर्ट नहीं करूँगा. Say he knows how to delete then and there, but if there is stuck up inside, उसको ओपन करके उसको आपने डिलीट करो. Deleting has 2 components. Either you are suppressing or really deleting through prashamana. These are we all know how to suppress. That is, if you want to use the word ignore. The real ignore is what this gentleman taught us. Real ignore is unka unko chhod do, Bhagwan ko chhod do. That is real ignoring.
Okay, I think that's all the questions. Thank you, Dr. Nagarajna, for a wonderful, insightful session. We have so much to learn from you, right from your simplicity, humbleness, your way of living to your knowledge. We are indeed blessed to have you as a speaker today. It is an honor to listen to you, especially on IDY. You are truly inspiring. We thank you once again for sharing your knowledge and valuable time with us.
It's so nice to be with the loving children of Lakulish. Dhanyavad. Namaskar.
Thank you. Thank you, Amma. Namaste. Now that we have heard how yoga helps elderly, it is time for us to also practice and learn practically the module of yoga for post-COVID well-being in elders. It gives me immense pride to introduce our PhD scholar, Ms. Trisha Rathod, to all of you. She's completed her master's in yoga education from Lakulish Yoga University and is currently pursuing her PhD. She has, from the beginning of her master's, supported the university in all its extracurricular activities, right from making arrangements to now being a PhD scholar. Trisha, you have come a long way. It gives me immense pleasure and pride to call you a student of our university. Over to you, Trisha.
Good evening, everyone. I am thankful to Lakulish Yoga University and organizing secretary of this webinar, Sahana ma'am, for lending me this opportunity. And during the practical yoga session, Vidhi Patel, PhD student of Lakulish Yoga University, is here with us, assisting us in yoga demonstrations. And those participants who would like to join us in practical yoga session would please can please switch to the video of Vidhi Patel. Besides elderly people, anyone can do this yoga protocol for self-practice. And this yoga protocol is also beneficial for those people who are suffering from post-COVID breathing complications. Okay, sit in any comfortable meditative posture. We will start the session with 3 Omkar. Everyone, please close your eyes. Place your hands either on knees with Chin Mudra or in Namaskar Mudra. Inhale deeply. Last time, inhale. Slowly open your eyes. And now we will do 3 rounds of Kapalbhati. First round in slow pace, 50 counts. Kapalbhati is a forceful exhalation with passive inhalation. Inhale up to your abdomen. Exhale forcefully from your abdomen. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Relax. Keep your eyes closed. And now those who have back pain, hypertension, or any heart problem, please keep practicing Kapalbhati in slow pace. Second round in medium pace, 20 strokes. Inhale. Exhale from your abdomen forcefully. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Relax. Focus on your abdominal region. And feel the changes after the 2 rounds of Kapalbhati. Third round, fast pace. Inhale, exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Relax. Keep your eyes closed. Feel the changes after 3 rounds of Kapalbhati. Now we will do some standing asanas, standing practice. But those who can't stand for a long time, may practice on sitting on the floor or by sitting on chair. The first practice, neck movement. Place both of your hands on your waist, hold your waist. Now slowly inhale and move your neck up, head up. Exhale, move down. Inhale, move your head up. Exhale, slowly move your head down. Inhale, head up, and while exhaling, slowly move your head down. Now, your head back to center. Now try to touch your ears to your shoulders without raising your shoulder. Bend your neck on right side while exhaling. Inhale, center. Exhale, left side. Inhale, back to center. One more time. Exhale. Inhale, center. Exhale and bend other side. Inhale. Now turn your neck to right side while exhaling. Exhale, turn right. Inhale, center. Exhale, turn left. Inhale, center. Again, exhale and turn your head right. Inhale, center. Exhale, left. Inhale, center. And now we will do neck rotation. Inhale and move your head up. Rotate your head. And while exhaling, come down slowly, rotating your head. Inhale up and exhale down. One more time. Inhale and rotate your neck and exhale down. Now center and rotate in reverse direction. Inhale up and exhale down. Second round. Now center, relax, relax. Now we will do Tadasana breathing or ankle stretch breathing. Both your feet shoulder level apart, or if you can easily balance your body, then you can place both of your feet closely, both of your hands resting beside your body. Slowly inhale and move your hands over your head. Inhale and stretch your ankles, heels, come on your toes. Raise your heels and come on your toes. Exhale, move your hands down, heels down. One more time. Inhale, both of your hands over your head and heels moving up, come on your toes. Exhale, move your hands down, slowly your heels down. And now third time, we will hold this posture for 5 to 10 seconds. Inhale. Stretch your body, hands over your head. Come on your toes. 5, 4, 3, 2, 1. Slowly while exhaling, move your hands down, heels down. And now Ardha Kati Chakrasana. Both of your feet shoulder width apart. Both of your hands resting beside your body. Now inhale. While inhalation, raise your hand, right hand over your head. While exhaling, bend to left side as per your capacity. Inhale, come back. Exhale, move your hand down. Inhale, raise your left hand up over your head while inhaling. Now exhale, bend to right side. Inhale, come back, and while exhaling, move down your hand. Inhale one more time. Inhale, raise your right hand over your head. While exhaling, bend to left side. Inhale, come back. Exhale, move your hands down. Inhale, move your left hand up over your head. Exhale, move down, feel the stretch. Inhale, come back. Exhale, move your hands down slowly. Inhale, move your hands from front, parallel to your shoulders, up to your shoulder level. We will do hands in and out breathing. While inhaling, move, stretch your hands out, open your chest as per your capacity. Inhale and exhale, come back. Move your hands close to each other. Inhale, open your hands, open your chest. Inhale deeply. Exhale. One more time. Inhale, stretch your hands, open your chest as much as you can. Slowly while exhaling, come back. Exhale and move your hands down. Now interlock both of your fingers, interlock the fingers of both of your hands and rest on the chest. Both your hands resting on side, elbows facing the ground. And now we will do hand stretch breathing, the first variation. Inhale and stretch your hands out up to the chest level in front of your chest. Exhale, move back your hands on your chest. Inhale, stretch your hands out in front of your chest. While exhaling, slowly move your hands back. Rest on your chest, elbows pointing the ground. Now third time, we will do with Akar chanting. Inhale, stretch your hands out. Second variation. Inhale and stretch your hands up to your forehead level. Inhale. Exhale. Move back. Rest your hands on your chest. Inhale one more time. Inhale. Stretch your hands up to forehead level. Exhale and move your hands back to your chest. Now third time we will do with Ukar chanting. Inhale, stretch your hands up to your forehead level. And now while exhaling, chant Okar. Third variation, inhale and move both of your hands over your head. Inhale, slowly move your hand up. Exhale down. Inhale, move your hands up. Exhale, slowly move your hands down. Rest on your chest. Now last time, we'll do with Makar chanting. Inhale up, raise your hands. While exhaling, chant Makar and move your hands down. Relax both of your hands, resting. And now we will do Padhastasana. Inhale, raise both of your hands over your head. Inhale. Exhale, slowly bend forward and try to touch your toes. Even if you can't touch your toes, just go forward as much as you can without stretching your body, without any extra exertion. Inhale, come back. One more time. Exhale and bend forward. Try to touch your toes. Inhale, move back. Exhale, put your hands down slowly. Now we will do some sitting asanas. Those who are sitting on chair may continue the Shukshma Vyayam while sitting on chair, or you can also sit on the floor on your mat in Shithil Dandasana. Both of your feet shoulder width apart, toes facing out, pointing outside, and hands in resting pose. Now join both of your legs together, back straight, hands on your ground. And now we will do toes movement. Inhale and bend your toes. Exhale, relax. Again, bend your toes. Inhale, relax. Exhale and relax. Now we'll stretch our ankles. Inhale and stretch ankles as much as you can. Stretch your ankles outside while inhaling. Exhale and move your ankles back. Inhale and stretch your ankles outside. Exhale and move your ankles back. Inhale. Exhale. Now fold both of your legs. Come into Sukhasan. Both. Raise both of your hands from front up to shoulder level. Now close your feet, make a fist. Thumbs inside your fist, thumb inside your fist. Yeah. And now start rotating in any one direction. And now in reverse direction. Relax. Now keep open your fist, palms facing the sky. Bend your hands from your elbows, hands touching your shoulders. And now elbow Shakti Vikasak. While exhaling, forcefully move your hand in front. Exhale, 1, 2, 3, 4. And now open your hands, elbows facing outward. Now again, Shakti Vikasak. Stretch your elbows, stretch your hands while exhaling. 1, 2, 3, 4. Keep your hands on your shoulders only. Now start rotating your hands slowly. While inhaling, move your hands upward. And while exhaling, your hands coming down. Rotate your hands. Last time in any one direction. Now rotate in reverse direction. While inhaling, your hands moving upwards, and while exhaling, move your hands down. Relax. Relax your hands. Now stretch your legs in front of you. Toes active, inside, pointing the roof. Now we'll do Hastapadasana. Inhale your hands and move. Inhale and move your hands over your head. While exhaling, try to touch your toes. Inhale, move your hands up. Again, while exhaling, try to touch your toes. Inhale, move your hands up. While exhaling, rest your hand beside your body. Now, fold your right leg from your knee and place your heel under your hip, and left leg from your knee and place your heel under your hip. Sit on your heels, come into Vajrasana. And those who have knee pain, please avoid this asana. Keep your eyes closed. Now slowly open your eyes. Open your knees up to shoulder level, shoulder width apart. Now we will do Ustrasan. Stand up on your knees slowly, and those who have knee pain, try to avoid this practice. While inhaling, move both of your hands over your head and try to touch your heels. Bend back and try to touch your heels. Exhale, come back, release. Go your hands one by one. Exhale, exhale, and again come into Vajrasan. Now slowly, while exhaling, move down and come into Shashankasan, your head touching floor. Take some long, deep breaths. While inhaling, come back into Vajrasan. Inhale and exhale. Now release your legs, stretch your legs in front of you. Come into supine pose, lie down on your mat. We will do alternate leg raising. While inhaling, raise your right leg up to 90 degrees, feet facing the sky. Slowly exhale and move your leg down. Inhale and raise your left leg up to 90 degrees. Exhale. Inhale, raise your right leg up to 90 degrees. Inhale and move your leg down. Inhale, move your left leg up to 90 degrees. Exhale and slowly rest your leg on the ground. Now we will do both leg raising. Join your legs together. Inhale, raise both of your legs together up to 90 degrees. Exhale, slowly move your legs down. One more time. Inhale and raise your legs up to 90 degrees. And slowly move your leg down. Now we will do Uttan Padasana. Inhale and move both of your legs up to 30 degrees. Inhale and move your leg up to 30 degrees. Slowly exhale and move your leg down. Inhale, raise your legs. Exhale, move your legs down. Relax. Take some deep, relaxing breaths. Slowly turn your body, lie down on your stomach. And come into Makrasan. Both of your legs shoulder width apart, toes pointing outwards. Close your eyes. Join your legs together. Toes passive. Keep both of your palms beside your chest, chin touching the floor. While inhaling, move your head, shoulder and chest up in Bhujangasana. Exhale down. Move your upper body up to your abdomen. Exhale, slowly move your body down. Now, relax your hands. Come into Makrasana. Now join your legs together. We will do alternate leg Shalbhasan practice. Move your palms under your thighs in such a way that your palms facing your thighs. Toes passive. Now inhale, raise your right leg up to your capacity. Exhale down. Inhale, move your left leg up. Exhale down. Inhale, right leg up. Exhale down. Last time, move your left leg up. Exhale down. Release your hands. Now slowly turn and come into supine posture. Lie down on your back. Now we will do Setu Bandhasan. Fold your legs, bend your legs from your knees pointing the sky, and your heels near your hip. Try to catch your ankles from your hand, and if you can't catch your ankles from your hand, just place your hands on your on ground beside your hips. And now inhale, raise your hip, your middle body up. Your shoulder should be touching the ground. Exhale down. Again, move your body up. Open your chest. Exhale down. Release your ankles. Stretch your legs. Rest your whole body. Close your eyes. Collapse your whole body on the floor. Your palms facing the sky. Both of your feet shoulder width apart. Toes pointing outside. Inhale deeply and exhale completely. Try to focus on your breathing. Inhale and exhale. With every breath you take, you are going deeper and deeper into the relaxation. Just relax. Now we will do a U and Makar chanting for deeper relaxation. Inhale. One more time, inhale. Inhale. Focus on your body. Feel the vibrations of U and Makar spreading throughout your body. Feel the slowness of your breath. Silence in your mind and peace in your heart. Now slowly move your toes, your fingers. Slowly turn your body to left side. With the support of your hands, slowly come into sitting posture without disturbing your peace. Keep eyes closed. Rest your palms on your knees. Now we will do Omkar chanting for one time. Inhale. Rub your hands. Place on your eyes. Slowly Open your eyes. Thank you so much. Over to Sahana, ma'am. Hello, am I audible?
Yes, in a minute.
Thank you, Tresha, for such a wonderful yoga session. And thank you, Vidhi, for a very nice demo session.
Thank you, ma'am.
We have come to end of today's program. I thank our sponsor, IUCYS, for helping us organize such an important and valuable and most needed webinar. I thank our speakers for their time. I thank our participants. I thank our President, Dr. Dinesh Bhai Amin sir, Provost Prashant Bhai Dave sir, General Secretary of Life Mission, Ashok Sinji, members of Life Mission, and most importantly, Rahil sir of our governing body for their constant support and encouragement and guidance. I sincerely thank Dr. Avinash Pandeji, Director of IUCYS, for supporting us. I extend my special thanks to Mr. Jose NJ, consultant to IUAC and IUCYS. He has helped us a lot to put this program in action. I would like to thank our student Yash Vora, MSc second semester, who has helped us in technical arrangement and has been quite patient with us. We in Lakulish Yoga University take pride in our students who are multi-talented and encourage them in path of holistic growth. Before we end today's program, I would like to make an announcement. We are arranging another national webinar tomorrow, that is on 22nd. It is on the topic Yoga for Women's Health and Well-Being in Post-Pandemic World, and it is from 11 a.m. onwards. A link for registration is shared in the chat box. Please do register. E-certificate will be provided. I hope to see all of you tomorrow in the webinar. With this, I end today's program. Sarve bhavantu sukhinah, loka samasta sukhino bhavantu. Thank you all.